ask a question, then have the CP candidates answer, and then the CE candidates answer. So the first question we have for the hospital candidates would be, how can we keep our physicians in the community, and how can the patient costs be lowered? We'll start with CP, Richard Cook.
Keep physicians and medical practitioners and support staff by good human resource practices. You give them what they need to do their job, and you make sure that their issues and their grievances are addressed. Hospital costs could easily be lowered by lowering the hospital costs. My experience is that that hospital bills at a rate of several times the services that you can get at Renown, where the CEO is in prison for financial mismanagement. So I think, and the hospital has a huge surplus, and lots of people are leaving the county, going elsewhere because of the overpricing. So if they lower the pricing, add more patient care, they could do just fine.
Mo, could you address those issues?
How to keep a doctor in Winnemucca. It's tough. We are a long way out in the middle of the desert. We continually talk to doctors, and we're always submitting, forms for the doctors to come look at Winnemucca and see what they can do. It's tough because sometimes the doctor may like it, but his wife or her husband, whatever the case may be, may not like Winnemucca. It's awful tough, but we are continually doing the recruiting that we can. As far as reducing costs, it's tough to reduce costs and still make money. And in the hospital, our hospital, we got to make money. One of the things we have done in the past was we reduced the cost of several lab seats. And in that reduction of cost, we have actually saved the community almost $1 million because of the lab fees. And we do surveys with other hospitals around the state, and we're right in the middle. We're not the lowest, but we're not the highest. Almost everything we do. Thank you.
And for Board CE, Garth. The question is, how can we keep our physicians in the community, and how can we reduce patient costs?
Well, the first thing that we need to do to keep doctors in this community is to aggressively recruit doctors that come from small communities. If they're people from big cities, they're not going to be comfortable in this lifestyle out here, because it's a way of life, and it's not for everybody. I think that's first and foremost what we need to do. And then as far as our billing, we just need to constantly monitor other hospitals and healthcare facilities, not only around our state, but around our county or our country, and make sure that we are competitive with them. We don't have to be the lowest. We definitely don't have to be the most expensive. But we need to stay somewhere in the middle where we can keep our financial stability in line, because that is a very important thing for the hospital, because once you lose that, it's really hard to get back. But then again, you need to make it affordable for the patients that come to the hospital to keep coming here. Because if it is too expensive, they're going to go other places. And the more people we have going other places, that's less revenue in our pocket. So that's one thing that we've got to look at. We've really got to balance that out. Thank you.
And Michelle Miller for CD.
I've actually done some doctor recruiting practices in Front, Nevada, and it is difficult to recruit to small town. Is that better? Yeah. So, I have recruited doctors in a small town in Front, where we moved from, and it is difficult to keep them. But I believe really what we need to do is we need to improve the atmosphere that they're working in. And in order to do that, we need to bridge the gap between our patients, our billing, and our doctors and staff. We need open lines of communication. When we have billing issues, when we have questions, we need excellent customer service. We need follow-through. Every time that we have a question, we're told that we'll be called back. We'll find out about a medication. We'll make you an appointment. The doctor's moving, whatever it is. We need follow-through, consistent. That way, when the doctor meets with the patient, it's a happy patient that feels that they're being taken care of. We have to build this trust back with our doctors and our community. By doing that, we'll be efficiently running the hospital, which means that the patients won't be being overcharged. We'll be more accurate with billing. We'll have better communication when we're having billing and able to make more adjustments on patient bills when there's a denial or some other reason. When there is a denial, are we communicating clearly with that patient? Are we calling them, or is it when they receive a bill in the end and they say, what is going on? Those things will reduce costs and allow us to keep doctors because it will be a positive working environment and a positive environment for patients.
Seat first for the next question is, if elected, are you in favor of localizing the existing patient billing process? And if so, how would you implement that?
Patient billing is a complex matter. It's not about localizing it or not localizing it. I think that we actually need to be looking at insurance aging reports and not just how long are our claims aging. How many denials are we receiving? What are we doing about those denials in a timely manner? What type of billing is going through? How are we receiving payments on these bills? How many complaints are we receiving? Those need to be evaluated every 3 months to 6 months. I spent the past 10 years looking at insurance aging and streamlining practices. It is absolutely the key to having any kind of facility for healthcare. It's where we build trust with the community, and it's where it's just so important. By evaluating that, if we get those reports and we say, you know what, you guys are doing a great job. You're not following through with us. We're not collecting the way we should. Our denials are too high. Then we need to look for other options. If that option's local and we can do it here, wonderful. If we can't meet those needs with the new healthcare industry the way it is, there's a lot of new requirements. I can tell you that in a billing situation, your regular family doctor, your walk-in clinic, your ER, and your diagnostic are all 4 completely types of billing, different billing. Each one of those is specialized by a certain type of billing department. Can we provide all of those? Can we provide some? Those are questions that need to be asked, and we need true numbers to really review them.
And Garth, can we get your response to that?
I think Michelle's answer was great. And if I'm elected, that is the kind of people that I want to manage our billing. That, if we have to outsource it, that's fine, but we need to have local control over it. We need to have somebody that's going to be there, that can hear the complaints, and they can hear the compliments for that matter too. But we need to have somebody there for the patients to make sure that our billing situations are accurate and they're in line with what's going on in our country. Because, like I said before, this is our community hospital, and we need to keep it a place that we all want to go, and we need to do it with accurate billing. Thank you.
And from CP, Mo, can you address that, please?
The billing issue is something that we've had problems with for quite a few years. There was billing issues many, many years ago when we had the billing in-home or in-house. There's billing issues where we got it now. There's like 3,400 pages of rules and laws when it comes into the Obamacare thing. It takes a very specialized group of individuals to do the billing on those. And yes, it is outsourced. I hate to say that, but the hospital needs the correct billing so that the hospital can be paid from insurance companies, private pay, whatever. It's a tough one, folks. But the outsourcing on the billing is then one of the things that has brought in more money for the hospital than anything. We have a more defined billing service, and it's actually working better for the hospital than when we had it in-house. Thank you.
And Richard will finish up with you for the hospital board.
It may be working better, but it's not working good enough. Campaign trail, I've talked to somebody yesterday who got a collection notice before they got a hospital. Now, as complex as billing is, it would be fairly simple to figure out how to get the bill to somebody before you turn them over for collection. And billing probably needs to be outsourced, but it doesn't necessarily need to be outsourced to the current source. By statute, there's supposed to be a finance committee made up of citizens chaired by a hospital board member for such problems as billing, long-range planning, grievances, and whatever. There are no standing committees, and if I'm elected, there will become standing committees that deal with these kind of problems where people can bring their problems to a committee and have it resolved through the committee and through the board level.
Okay, that's all the questions we have for the hospital board. If everybody give all the candidates a good round of applause.